Hello, welcome to this video. My name is Christiana Mausi Sarah. I would like to talk about gonorrhea, which some people call gono. So gonorrhea is one of the most common sexually transmitted infections among young people, among teenagers. So you are looking at those from 15 years to 24 years who are sexually active. Gonorrhea is very common among that age group. Now, the good news is that gonorrhea is caused by bacteria and it can be cured easily using prescribed antibiotics. So gonorrhea is spread through oral sex, through vaginal sex, or through anal sex. So the infection is carried in the vaginal fluid, is carried in the semen or the cum, and it's also carried in the pre-cum, which is also known as the pre-ejaculate fluid. That is the clear fluid that comes out of the penis when a man is aroused. When the penis is erect, there is that clear fluid that comes out of the penis. So that is known as the pre-ejaculate or pre-cum. And that fluid can carry the bacteria, the gonorrhea, if the man is infected. It can also be in the woman's vaginal fluid. So if you have unprotected sex with an infected woman or man, you will be infected. So the infection, it can infect your penis, your vagina, your anus, if you have anal sex, your throat, and your eyes, and even your urethra. The urethra is the tube that carries urine outside or from the bladder outside the body. So it can cause bladder infection or urinary tract infection. Now, gonorrhea, if somebody has gonorrhea, what is dangerous, and it's not just gonorrhea, some other sexually transmitted infections as well. Somebody may have gonorrhea, but they will never have experienced any symptoms. So the person is not even aware that he or she is infected. They look healthy. However, if they have unprotected sex with anybody, they infect the person. So imagine a man or a woman has gonorrhea and does not have protected sex, does not use condom during sex with others. It means he'll be spreading the infection to all those sexual partners. So please, it's important to get tested once you are sexually active. Don't wait for symptoms to show. If you are starting a new relationship, it's important to get tested for sexually transmitted diseases, including gonorrhea, HIV, and the rest. Okay, so what are some of the symptoms that you experience? Another way that it could be, transmitted is from a mother to her baby during birth. So if a woman has gonorrhea, which was undetected and treated before, she delivers, during delivery, gonorrhea can, infect the child's eye, the baby's eyes. It can even enter the baby's blood and cause serious infection. Okay, so these are some of the symptoms that you experience if you have gonorrhea. But remember, majority of the people, in fact, almost 80%, they do not show any symptom. So you could experience, for women, you could experience a painful or burning sensation during urination. And then you could also experience, increased vaginal discharge. And the discharge could be yellowish or even bloody. You could also experience bleeding in between your periods or bleeding after sexual intercourse. So please, if you are a woman and you experience bleeding, you have your menses, and then instead of the menses to come at the next cycle, in between you still bleed intermittently. Please do not take that for granted. Seek prompt medical care. It may be, gonorrhea or any sexually transmitted infection if you are sexually active. So please do not relax. Then apart from the pain during urination, and the men also experience painful urination, or that burning sensation whilst urinating. I mentioned vaginal discharge, which is yellowish or bloody. Then bleeding in between your periods, or bleeding after sexual intercourse. Then the men experience, yellowish discharge. The discharge of your penis could be yellow in color, could be white, or greenish green discharge coming from your penis. You could also experience pain and swelling in testicles. So if you have any of these symptoms, please seek prompt care. Do not go and buy medicine off the counter to take. See, if you do not get prompt treatment for gonorrhea, it can lead to several complications. For men, the gonorrhea, the bacteria, the infection will spread to your epididymis. Epididymis is, a coiled tube that is, connected to your each of the testicles. So when after your testes, when they produce the sperms move to your epididymis, mature there, and get stored there temporarily until during sexual intercourse, when they move out, the sperms move out to be released. So if you get gonorrhea and you do not get proper medical treatment, it means it could it's going to affect your reservoir, what is storing your sperm. So it means it could lead to infertility. So please make sure you seek prompt care. Having protected sex is very important. If you cannot abstain, the teenagers, the young people, if you cannot abstain, please wear condom. Use condom consistently, meaning every time you have sex. And always, test your partner, test yourself for sexually transmitted infections. Anytime you are starting a new relationship, it's very important. And then for women, if you do not treat gonorrhea early, or you just go and get some medication to handle it your own way, the symptoms may go. You think you have fully treated yourself, but no, the infection will ascend to your cervix, it will ascend to your womb, it will ascend to your tubes, your uterine tubes, and it could cause a condition known as pelvic inflammatory disease. And this will lead to, scarring, forming scar tissues in your tubes. And this can cause ectopic pregnancy. It can even cause infertility. If your tubes are blocked, it means fertilization cannot occur. The egg and the sperm cannot meet for you to get pregnant whenever you want to. So please, it's a serious issue. Do not just, take it for granted. Make sure you seek care, get tested, routinely tested for gonorrhea and other sexually transmitted infections. Then for another complication that could result is if a woman has gonorrhea, for which she was not, treated for, the gonorrhea was not treated. If you get pregnant and you are giving birth, you can infect your baby. You can give, eye infection to your baby from gonorrhea. And the bacteria can also enter the baby's blood and cause infection, serious infection. And it can cause blindness. Can you imagine your baby being blind just because you have gonorrhea and you did not get tested and treated? So please, once you are sexually active, always get yourself routinely checked. It's very important. So take care, have protected sex. If you cannot abstain, use condom and stay safe. Get tested for gonorrhea and other sexually transmitted infections and get properly treated. Don't just go and use any, medication. Don't self-medicate. Get treated for gonorrhea. Thank you, and please take care. Bye.